We have seen the number of coronavirus cases decline drastically over the past month, and that's according to recent health data. But experts are still concerned, and joining us now to discuss this further is Dr. Chris Pernell, public health physician and fellow at the American College of Preventive Medicine. Thank you for joining us this morning, doctor.
Good to be here.
I just love having you back. So, Dr. Pernell, I just want to know, can you talk about why experts are still concerned, especially when it comes to these new variants?
So these new variants are concerning because, for instance, the UK variant is anywhere between 35 to 45% more transmissible. The data is somewhat suggestive that it could also potentially be more virulent, even if it isn't a more virulent strain. The fact that it's more transmissible means that you would have more infections. More infections could contribute to more hospitalizations. More hospitalizations could contribute to sicker outcomes and ultimately lead to death. So that's the concern. But if we can get ahead of the variants, we can help to safeguard the public. And the way that we get ahead of the variants is by doing those staple public health guidelines that we've been discussing.
And part of that, obviously, you have wearing masks and honestly, even getting the vaccine. And I know that this hits close to home for you. Can you just tell us more about your story and why getting this vaccine became a priority for you?
So look, I'm a public health physician. I believe in public health science. I love public health. Hopefully you can hear that in my voice. But this pandemic has been devastating. It has been devastating for all people, but in particular for Black and Brown communities. I saw that in Newark, New Jersey at the height of the surge back in March and April of 2020. And not only did I see how it devastated my community disproportionately, I lost my father to this pandemic. My father had been hospitalized for an unrelated reason, got exposed to coronavirus, and died on April 13th. In addition to losing my father, at this point, I've lost two cousins, and my sister, who is a breast cancer survivor, is a COVID-19 long hauler. So that's what we're describing when we're talking about a disproportionate impact. And the way that it affected me personally, I needed to be a part of the solution. And we won't be able to undo the inequities unless we have diverse representation in clinical research trials. So I participated in the Moderna COVID-19 vaccine trial, and I've never regretted it. Because others have stepped forward, like myself, we are at the point where we are now. We have 2 mRNA vaccines that have been approved through emergency use authorization, and we have powerful tools in our toolkit to help beat back this pandemic.
And during a recent town hall, actually, President Biden said every American who wants to get a vaccine will have access to it by the end of July. I just want to know, from your experience and your expertise, do you think that this is realistic?
Well, you know, we're doing best guess estimates, right? And I think it's safe to say, looking at the capacity of the manufacturing, looking at J&J, where it is in the FDA's EUA process, I do think we have to couch expectations that everyone having access to the vaccine probably won't happen until the summer, and then everyone actually being vaccinated, because that's a different endpoint. Everyone being vaccinated probably won't happen to the end of the summer and into the early fall. So, but we have to get people ready and prepared on their decision journey, that when a vaccine is available to them, that they're ready to receive it.
And do you believe sharing your story helps with this? Because seeing a doctor, and not just any doctor, but a woman of color, a person of color, do you believe that that can give the people out there who may be scared to get it a little bit of faith?
Most certainly. I believe that, and that's my hope. And this is why I continue to share and elevate my family's story. Look, Black and Brown persons historically have experienced horrific abuses at the hand of the healthcare system. You could think about infamous cases like Tuskegee. You could think about Henrietta Lacks. But in addition to those historical injustices, ongoing discrimination and bias that contribute to present day disparities disparities also give people cause for concern. The fear, the skepticism, even the hesitancy, as some people have called it, I think it's more appropriately termed being historically aware. It's a learned behavior. And as part of understanding where people are coming from, we can begin to, in socially and culturally fluent terms, elevate the voices of people who look like those in community who have questions, people that those in community consider to be trustworthy. And I believe that the more public health physicians like myself, the more healthcare providers generally who are persons of color, and the more folks in community, folks who are your family members, folks at your barbershop, folks at your church, who can talk about their experience with vaccination, that those who are in that wait and see category will be able to have the information that they need to help them along their decision journey.
And doctor, I want to know what current issue stands out to you right now, specifically when it comes to COVID-19. What do you have your eye on?
Access, access, access. I think about access every day, whether it's me personally trying to help a senior citizen in community who's struggling to register for a vaccine because A, he doesn't know how to get online, B, he's concerned about how does he check his email. I'm concerned about access. I'm talking about, helping people navigate that decision journey, but we in healthcare, we at the state level, we at the local level, even the federal level, we need to think through what are the barriers to access, what are the information barriers? What are the transportation barriers? What are the convenience barriers? What are the language and literacy barriers? What are the social and cultural barriers? And begin to undo those barriers with a sense of a full court press and focus. That's the only way we can achieve equity. So that's where I'm focused.
And do you believe that's what needs to happen moving forward? Because there are still a lot of question marks, and you've seen that some people can't even get access to the vaccines because of these winter storms. What should we do moving forward? Because there's a lot at stake.
What we should do moving forward is invite more people to the table. The way that you get an inclusive decision making is making sure that you have those that you want to impact by the decision as a part of the solutioning process, hearing from people what those particular challenges may be. And that's how you begin to plan around and plan ahead of those challenges. And so we can't lose sight of the ball on the court. We have to remain focused. And access, 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 access. I'm going to repeat it over and over and over again. That is the only way to achieve equity. And there's more that we can be preemptive, thinking about doses, how they'll be distributed, when they'll be available, coming off of manufacturing lines, thinking through places and locations that we can have mobile vaccinations, whether it's at churches, whether it's at grocery stores, whether it's at schools, whether it's at community health centers, and whether it's at pharmacies. We have to realize those plans well ahead of when the doses are actually ready so that those plans have been rehearsed, thought through, and the logistics are sound.